I'm Nicole.
I'm Rebecca, and this is a review of our off-campus field placement. I shadowed Dr. Jeff Weeks, who is a chiropractor at Dynamic Health and Performance Sports Clinic.
I shadowed Heather Marchment, who is an athletic therapist at the sports clinic at the University of Toronto Mississauga campus.
Basically, I followed Dr. Weeks around and helped him with whatever he needed. Obviously, I'm not certified, so I couldn't really touch any of the clients, but I managed to go through a lot of exercises with them, help them with their corrective exercises, and I got to learn a lot about the different injuries and the different ways that you were able to treat them.
A lot of my duties at the clinic consisted of doing exercises with a lot of the clients, making sure that they were doing them properly. Heather and I both went up into the gym and the high performance lab with a lot of the athletes to make sure that they were working on their strength building and recovery exercises.
The biggest thing that I learned is that I'd gone into this placement thinking that all chiropractor did was just crack backs all day. So it was really interesting to see in this clinic setting how he does a lot more than that. He did it maybe 5 or 6 times the whole time I was there. So he works with a lot of manipulation with the clients and a lot of corrective exercises, really building strength up in their muscles. So that was definitely interesting to learn that not all chiropractics just crack backs.
The biggest thing that I learned was a patient came in with a detached hamstring. He got it when he was wakeboarding. He was a 54-year-old man. So, I mean, he was very athletic, but it's taken him quite a long time to get back to the way he was before. But his progress is excellent. He's back to normal already, which is cool.
So this exercise that I learned at the clinic is called baby rolls. And this is something, like the title suggests, that we were able to do as a baby. But as we grow older, our body has learned to compensate for the weakness in our abs and using our upper and lower limbs instead. So this exercise is really about retraining our proper movement patterns. So Nicole is going to take her arms and she's going to put them above her head. And the objective of this is to get her to move over and flop onto her stomach without using the assistance of her legs, only her arms and her core. So she's going to lift up her head and smell her armpit, and then she's going to take her right arm and reach over, contract her core, and try to pull herself over without using the assistance of her legs, and she's going to flop over. This is definitely a lot harder than it looks, and it definitely takes a lot of time in order for a client to be able to master it.
At the sports clinic, I learned a stretch that stretches out mainly your hip flexors and your glutes. So Becca's going to lay on her side and with her head on a pillow to ensure a neutral position. She's going to pull her knees up into the fetal position to create as tight as an angle as she can. And with her right hand, she's going to grab her left knee and bring her right heel to her butt and grab her ankle with her left hand. Then she's slowly going to open up her chest, and then she'll feel a stretch in her hip flexors and her glutes.
I definitely enjoyed working at the clinic. It was kind of hard to get the full effect of it because you couldn't be very hands-on. So at times it was more watching than actually doing, but it was definitely a good experience. Getting to know the background of all of the different things that you can do, so that was definitely interesting.
Yes, I really enjoyed going to the sports clinic. It was an excellent opportunity, and it definitely opened up my perspective into what the therapy kind of occupation is like.
I'm not sure if I would make a career out of it just yet. I think because you couldn't really work with the clients all that much, that it was hard to gauge it for yourself. It's great to see other people doing it, but you doing it yourself is a completely different thing. So probably getting more background information on it would be great, and maybe shadowing different people other than chiropractors would probably give me a better understanding of it and help me to decide whether or not I would want to do that.
I think I would make a career out of it. It's, like I said, like it was an excellent opportunity, and it's great to see how the therapy occupation is, but putting in that many hours and like working with all the patients, especially like young kids that don't engage in their exercises, it's kind of frustrating, but I think I'd do it.